I am Dr. Pradeep Kumar K, Professor and HOD Department of Shalakya Tantra, Yenepoya Ayurveda Medical College. Here I am going to present a topic, Netra Sandhigata Rogas. The objectives of the presentation: to understand the Netra Sandhi and types, classification of Netra Sandhigata Rogas, to define the Lakshana of Netra Sandhigata Rogas, to discuss the management of Netra Sandhigata Rogas. So, before moving on to the Netra Sandhigata Rogas, there is a short discussion on the Netra Sandhi. So, this Netra Sandhi is the junction between the mandalas. In classical Ayurveda Sushruta Samhita, Netra Rachana Sharira is explained in detail. So, in that 5 mandalas are mentioned. These mandalas are circular form of the arrangements. So, in this image, you can see the Pakshma or the eyelashes. There is one circular form of arrangement. Next, that is called as a Pakshma mandala. Next one, Vartma mandala, 2 eyelids. So, it is a Vartma mandala. Next, Shukla mandala, there is a sclera or the bulbar conjunctive area. It is one circular form of arrangement. It is called Shukla mandala. And Krishna mandala, that is a blackish or the brownish portion, that is iris, is Krishna mandala, and centermost portion is called as a Drishti mandala. So, these circular form of arrangements are 5 in number, and these are called as a Netra mandalas. So, the junction between these mandalas, we call it as a Netra Sandhis. So, total 6 Sandhis are mentioned in by Acharya Sushruta as well as the Vagbhata, and in these 6 Sandhis are affected by the 9 diseases. So, these 9 diseases are called as a Netra Sandhigata Rogas. So, these mandalas are affected by the junction between the mandalas, we are call it as a Sandhis. There are 6 Sandhis are mentioned in the classical text. The first one is a Pakshma Vartmagata Sandhi. So, junction between the eyelashes and lid is called as a Pakshma Vartmagata Sandhi. It is a lid margin. And Vartma Shuklagata Sandhi, where the eyelid and the bulbar conjunctiva with joints, that is a conjunctival fornix, is called as a Vartma Shuklagata Sandhi. Shukla Krishnagata Sandhi, where Shukla Mandala and Krishna Mandala joints is called as a Shukla Krishnagata Sandhi. It is a limbal area. And Krishna Drishtigata Sandhi, it is a pupillary margin. And Kaninaka Sandhi. Kaninaka Sandhi means the both eyelid joints in the medial canthal area is called as a Kaninaka Sandhi. Kaninake Nasa Samipasthitaha, which is located close to the nose. Whereas Apanga Sandhi means Bru Puchanta Sitaha, which is located lateral part of the eye, that is the lateral canthus, is called as a Apanga Sandhi. So, these 6 Sandhis are affected by the 9 diseases called as a Netra Sandhigata Rogas. So, these Netra Sandhigata Rogas mentioned by Acharya Sushruta are Puyalasa, Upanaha, Pittasrava, Kafasrava, Raktasrava, Puyasrava, Parvani, allergy and Krimigranthi. So, total 9 Sandhigata Rogas. So, these 9 Sandhigata Rogas are also mentioned by Vagbhata, but instead of Pittasrava, Acharya Vagbhata mentioned Jalasrava. So, out of these 9 Sandhigata Rogas, 5 are Asadhya in nature. So, they are 4 Sravas and 1 allergy, and remaining 4 are Shastrasadhya in nature. They are Upanaha, Krimigranthi, Puyalas and Parvani. Next, we will move on to each disease in detail. So, the first disease is the Puyalasa. Here the name only suggests Puya and Alasa. So, Puya means pus filled. So, the swelling which is filled with pus is called as a Puyalasa. Here dosha is Tridoshaja condition, and involved Sandhi is Kaninaka Sandhi, and this condition is Vedana Sadhya Roga. And the Lakshanas told by Acharya Sushruta are Pakwa Shofa Sandhijaha Samsravedya Sandram Puyam Puti Puyalasasa. That means there is a Pakwa Shofa, the Shofa, the suppurative swelling in the region of Sandhi. Here Sandhi means you have to take Kaninaka Sandhi. It is told in Dhallana in a commentary. Sandhi means you have to take it as a Kaninaka Sandhi. In the Kaninaka Sandhi there is a Pakwa Shofa, suppurative swelling, and Samsravedyascha Sandra. When it ruptures, there will be a thick discharge. Puyam Puti Puyalasasa. The thick, foul smelling, purulent discharge is considered as a Puyalasa. In total, the suppurative swelling in the region of medial canthus or the Kaninaka Sandhi, when it ruptures, there will be a foul smelling pus discharge. And as per the Ashtanga Hridaya, Puyalasa Vruna Sukshma Shofa Sambramba Purvakaha Kanina Sandavadmai Puya Sravisa Vedanaha. That means there is a Sukshma Vruna Yukta Shofa, and which is this, when this swelling is burst open, there will be a pus discharge, and which is located in the region of Kanina Sandhi is called as a Puyalasa. And Arunadatta added Anaha as a Lakshanas, and Acharya Vidya told Kleda, Toda and Beda along with the above Lakshanas. And regarding the Chikitsa, Puyalaso Shonita Mokshanam cha hitam Tateva api Upanahanam cha Krishno Vidischa Akshno Pakagati Yatavidanam Beshajam Prayojya. Here Rakta Mokshana is the main line of a treatment, and along with that Upanahasveda in the form of Pralepa and Bandhana. For the internal and external Shodhana is administered in case of if a dosha utlesha is severe. And also in the Paka Chikitsa advised, if the condition is in the Paka stage, you have to go for a Paka, and in a condition in the early stage, in the acute condition, we can go with the Rakta Mokshana. And Anjana Yoga, Saindava Ardarga Kasisa, Loha Tamra Churnitehi, Churnanjana Prayunjita. So Anjana prepared out of Saindava Ardaka, Kasisa, Loha, Tamravasma along with Madhu, it has to be applied as Anjana. Puyalase Tvashante, Antardaham Sukshma Shalakaya. As per Ashtanga Sangraha, if by above treatment, if the disease does not subside, then you have to do the Agni Karma with the help of a Sukshma Shalaka. And this condition is correlated with the dacryocystitis. It is an acute suppurative inflammation of the lacrimal sac. So the next disease is Upanaha. This condition here, next disease is Upanaha. Here the involved dosha is Kapha dosha and site is Drishti Sandhi. Sadhya Sadhyata, it is a Bedana Sadhya Vyadhi. Grantirna Alpo Drishti Sandhava Pakaha Kandu Prayo Niru Jastu Upanaha. Sushruta Uttara, second chapter, sloka number 4. So here Grantirna Alpo, it is a nodular swelling in the region of Drishti Sandhi. Here Drishti Sandhi, you have to take Krishna Drishtigata Sandhi as a Drishti Sandhi. Kandu Prayo Niru Jastu Upanaha. So swelling associated with itching, and it is a painless condition. This condition is called as a Upanaha. As per the Ashtangradaya, Kafena Shofa Tikshnagraha, Kshara Budbhuta Kopamaha, Prutumula Bala Snigdha, Savarna, Mrudupichalaha, Mahan Pakaha, Kandupanaha, Sa Nirujaha, Ashtangradaya Uttara, 10th chapter, sloka number 3. So here, Kafena Shofa, the Prakupita Kapha produces a Shofa, and which is Tikshnagraha, having a pointed tip and resembles like a Kshara Budbhuta Kopamaha. So how the bubbles of Kshara appears, similarly the swelling appears, and which is having a Prutumula, broad base, Bala, and it's a strong, and Snigdha, Savarne. Savarne means having the same color of the surrounding area, Mrutu Pichilaha, soft and pichila in nature, and it's a Mahan Paka, Apakaha, which does not undergoing for a Paka, Kandu Upanaha Sa Nirujaha, and which this condition is painless, is called as a Upanaha. And Chikitsa, Bittopanaham Kafajam, Pippali Madhu Saindavehi, Lekayen Mandalagrena, Samantat Prachayedapi. Sushruta Uttara, 14th chapter, sloka number 9 and 11. Here it is an Bedana Sadhya Vyadhi. Before the Shastra Karma, as a Pura Karma, Snehan and Svedana has to be carried. Then Bedana, followed by Pratisarana with Pippali Madhu and Saindava. If the swelling is or the Pitaka is a bigger one, then and painless, then Bedana followed by Lekan and Pratisarana has to be done. And if Rakta Tushti is more, then we have to go for a Bedana, Prachana and Pratisarana has to be carried, and as a Paschat Karma, Vrunaropana Chikitsa has to be adopted. So next we will move on to the next condition is called as a Netra Srava. There are 4 types of Netra Sravas are mentioned in the Samhitas. They are Pitta Srava, Kapha Srava, Rakta Srava and Puya Srava. Whereas Acharya Vagbhata mentioned Jalasrava, Kapasrava, Raktasrava and Puyasrava. Instead of Pittasrava, Acharya Vagbhata mentioned Jalasrava. And this Netrasrava is also called as Netra Nadi by Sushruta and Netra Nali by Madhava Nidana. And as such by nature there is no Vatasrava. All these Sravas are asadhya in nature, and the involved Sandhi is Kaninaka Sandhi. In this Netrasrava, the Vishesha Samprapti is told by Acharya Sushruta, that is Gatva Sandhina Ashtumargena Doshaha Kuryuhu Sravan Rugvihinan Kaninat Tanvai Sravan Netra Nadi Mateke Tasya Lingam Kirtaishe Chaturda. That means the Prakupita dosha enters into the Sandhi, that Kanina Sandhi, and enters into Ashtumargena Doshaha, and that enters into the dosha enters into Ashtumarga and produces a Srava. This Srava is painless, and this condition is called as a Netra Nadi or the Netra Srava. It is of 4 types. First one is the Pitta Srava. Here Pitabasam Neelamushnam Jalabam Pitta Srava Samsravet Sandhi Madhyat. Due to the Pitta Prakopa, there will be a thin watery discharge having a Pita Varna or the yellowish color or Neela Varna, and Ushnam, its a discharge will be somewhat hot in nature. This condition is called as a Pitta Srava. And Kapha Srava. As per Sushruta, Shvetam Sandram Pichilam Samsravedya Shleshmasravo Nirujam Sa Pradishtaha. That means due to the Kapha Prakopa, there will be a thick Pichila Yukta discharge. It's called as a Shleshmasrava, and this condition is painless. According to Ashtangradaya, Shvetam Pichilam Bahalam Sravet. So discharge will be a white, slimy and in large quantity. Raktasravam. Raktasravam Shonitotaha Sa Raktamushnam Na Alpam Samsravet Nati Sandram. This condition occurs due to the Rakta Dushti, and there will be a blood discharge from the eyes, and which is hot in potency, hot in nature, and heavy and not so thick. Nati Sandram. This condition called as Raktasrava. Raktad Raktasrave Tamram Bahushnam Cha Ashru Samsravet. Ashtangradaya Uttara 10th chapter sloka number 4. So due to the Rakta Dushti, there will be Raktasrava, and which will be Tamra Varna Yukta and Bahu in a large quantity and Ushna. So this condition is called as a Raktasrava. Next is a Puyasrava. As per Sushruta, Pakaha Sando Samsravedyascha Puyam Puyasrave Aneka Rupam Pradishtaha. Sushruta Uttara 2nd chapter sloka number 6. Here the separation in the Netra Sandhi, Paka Sando Samsravedyascha Puyam, there will be a pus discharge. Puyasravo Aneka Rupam Pradishtaha, having a many different varieties of symptoms, is called as a Puyasrava. As per Ashtangradayam, Puyasrave Malaha Asram Vartma Sande Kaninakat Sravayanti Muhu Puyam Sa Asram Twang Mamsa Pakataha. Here the doshas are Tridosha, along with the Rakta Tushti. There is a localization in the Vartma Sandhi and produces a discharge through the Kaninaka Sandhi. So there will be a frequent discharge of a blood due to the separation of Twak, Mamsa and Pakata. So discharge of a pus along with blood due to the Twak, Mamsa, Pakataha. Pak of Twak and Mamsa. Next condition, Jalasrava. This Jalasrava is mentioned only by Ashtangradaya, and here Vayu Kruddam Sira Prapyam Jalabam Jalavahinihi Asru Sravayate Vartma Shukla Sando Kaninakat Tena Netram Sa Rugraga Shofam Syat Jalasravaha. Ashtangradaya Uttara 10th chapter sloka number 1 and 2. Here the Prakopita Vata enters into the Ashtuva Siras and produces a Jalasrava. Ashru Sravayate Vartma Shukla Sande Kaninakat, and there will be a Jalasrava, the watery discharge from Vartma Shuklagata Sandhi and Kaninaka Sandhi. Tena Netram Sa Rugraga Shofam Syat Jalasrava, and this condition is associated with Rug, pain, redness and Shofa. So all these Netra Sravas are asadhya in nature, and this Sravas, in that Jalasrava is correlated with the watering of eye or epiphora or hyperlacrimation condition, whereas Pitta and Raktasrava correlated with acute dacryocystitis. Kaphasrava and Puyalasa can be correlated with chronic dacryocystitis. So in this chart you can see the difference between the Netra Sravas. So the features like doshas, involved doshas, color of the Netra Sravas, Srava Sparshas, nature of the Srava, and involved Sandhi. The next disease, Parvani. Here the involved dosha is Rakta dosha and site is Shukla Krishnagata Sandhi according to the Dallana, Vartma Shukla Sandhi according to Ashtangradaya. This condition is Chedana Sadhya, Tamra Tanvi, Daha Shulopapannam, Raktajneya Parvani, Vrutta Shofaha. Here Tamra Varna Yukta Pitaka, and which is Tanvi, thin, and Daha Shulopapannam, associated with burning sensation and pain. This condition is called as a Parvani. So in total there will be a Vrutta Shofa, round swelling, which is Tamra Varna Yukta, thin, associated with Daha and Shula. Condition is called as a Parvani. According to Ashtangradaya, Vartma Sandhyasya Shukle Pitaka Dahashulini Tamra Mudgopam Binnam Raktam Sravati Parvani. A postular growth or the Pitaka over the Vartma Shuklagata Sandhi associated with Daha and Shula, and she is having a Tamra Varnayukta and size of a Mudgopamannam, so just like a green gram size. So and Binnam Raktam Sravati Parvani, when it is breast open there will be a Rakta Srava. This condition is called as a Parvani as per the Ashtangradaya. Chikitsa, as per Ashtangradaya, Parvani Badishonatam Bahya Sandhya Tribhagataha Vruddhi Patrena Vardyam Ardhe Syat Ashru Gatiranyata Chikitsa Charmavat Kshaudra Saindava Pratisarita. Here Parvani has to be lifted. It's a Shastra Sadhya Vyadi. Here Parvani has to be lifted with the Badisha Yantra and from the 1/3 of the Bahya Sandhi, and it has to be cutted with the help of a Vruddhi Patra. Ardhe Syat Ashru Gatiranyada. While doing the cutting of this Parvani, we have to cut only the half the length, otherwise there will be a Ashru Srava will be there. So Chikitsa cha Armavat Kshaudra Saindava Pratisarita. After that Paschat Karma, like you have to follow the Pratisarana with Kshaudra Saindava and Pratisarana you have to do, just like a Arma Chikitsa. So this condition is correlated with flictannular conjunctivitis. And next disease is allergy. Here dosha is it's a Sannipataja condition, and involved Sandhi is Shukla Krishnagata Sandhi according to Sushruta, and Kaninaka Sandhi according to Ashtang Hridaya. And this one is Asadhya condition, and it's also considered as an advanced condition of Parvani as per Sushruta. Jata Sandho Krishna Shukle Alaji Syat Asminneva Kyapite Purvalinge. The growth over the Krishna Shuklagata Sandhi having the same feature of a Parvani with more severity is called as a allergy. Whereas in Ashtang Hridaya, Kaninasyantaralaji Shofyo Ruktoda Dahavan. That means swelling develop inside the Kaninaka Sandhi and associated with Ruktoda Dahavan, pain, pricking sensation and Daha or burning sensation is called as a allergy. As per Dallana in the commentary tells that Tanvi Parvani Tata Sula Punaralaji Yam Sannipataja Sadhyacha. That means Parvani is thin, whereas Stula Punaralaji in the severe form is allergy. Yam Sannipataja Asadhya Sad, whereas allergy is Sannipataja and Asadhya condition. So in this chart you can see the difference between the Parvani and allergy. The involved site Krishna Shuklagata Sandhi and Parvani, and allergy also same, whereas Ashtang Hridaya mentioned is a Kaninaka Sandhi, and size the smaller one is Parvani, bigger one is allergy. Dosha Rakta Doshaja and Tridoshaja allergy, and Lakshana in the mild form in the Parvani and the severe form is the allergy. Sadhya Sadhyata, it is a Chedana Sadhya Parvani, allergy is Asadhya in nature. The last disease is a Krimi Granthi, Dosha Kapha Dosha, site Pakshma Vartmagata Sandhi, and it is an Bedana Sadhya Vyadi. Krimi Granthir Vartmana Pakshmanascha Kando Kuryu Krimeya Sandhi Jata Nana Rupa Vartma Shuklasya Tando Charanto Antarnayanam Dushayanti. Sushruta Uttara, 2nd chapter, sloka number 9. So here, due to the Kapha Prakopa, there is a presence of different size and shapes of Krimi in Vartma and Pakshma region, and associated with the Lakshan like severe itching. So these Krimis are moved towards the Vartma Shuklagata Sandhi and destroys the inner contents of the eye. Is called as a Krimi Granthi by Acharya Sushruta. Whereas Ashtang Hridaya Apangeva Kanineva Kandusha Pakshma Potavan Puyasravi Krimi Granthi Granthi Krimi Yuto Artiman. That means Granthi develop over the Apanga or Kanina Sandhi associated with itching and burning sensation, and there is a Pakshma Potavan, that means falling of eyelashes. If Granthi ruptures, there will be a discharge of pus along with Krimi and pain. So this condition is called as a Krimi Granthi, and Yoga Ratnakara it is called as a Jantu Granthi. Chikitsa Samyak Svinne Krimi Granto Binne Syat Pratisaranam Trifala Tutta Kasisa Saindavescha Rasakriyaha. That means Svedana you have to do, that is a Mrudu Svedana, then Bedana, the Granthi has to be, Bedana incision has to be done, and Pratisarana with Trifala Tutta Kasisa Rasakriya you have to, and Saindava you have to prepare the Rasakriya and it has to be applied. And this condition we can correlate it with blepharitis. So glance on the Sandhigata Roga chart. So here the disease involved dosha, Sandhi, Lakshana and Chikitsa are depicted in the full chart. These are the references. Here I will conclude. Thank you.